Joining me this morning from Keystone Physical Therapy up at the plaza up there on the west end is Michelle Paulin and Jeanette Newbold, who is patient service manager at the facility. And tell us about Keystone. How long have you been in business? Do you know? A couple of years?
No, we've been in business for a while. Approximately 10 years, I believe the facility
Really?
has been there.
I didn't realize that.
Yeah.
Okay. What do you tell us your hours and what you do there?
We are open from 7:30 every morning. We open. And Monday, Wednesday, Thursday, we're open until 6. And then Tuesday and Friday until 2:30 on Tuesday and 12:30 on Friday.
Okay. By appointment only?
By appointment only. And I mean, we do see patients for free screenings, so they could stop in to make an appointment. Typically, if I'm not busy, I'll see them right there on the spot. Otherwise, I ask that just so that I can fit them in, that they make an appointment.
Physical therapy is quite popular because a lot of people, it seems, in this area, I don't know if it's the weather or what, seem to be having back pains and leg pains and joint pains. What do you do as far as is it massages and stuff like that?
The primary role of a physical therapist is to get people back to function and to functioning optimally with their health and with their life. And get them out of pain, allow them to be pain-free, educate them about how to move their body, how to move correctly. So any joint pain, whether it be just pain or if they've had a surgery, neck, knee, shoulder, hip, back, we can see and we can treat. I also treat women health problems. So a lot of women suffer from urinary incontinence. They think that that's supposed to be a normal aging process, and it is not. So I do a lot of women's health specialties, postnatal, prenatal, cancer therapy, workers' compensation.
My mom is been having a terrible weekend because of back pain, and not sure how it. I mean, she's had it before. It's a problem like a herniated disc that's been there, and she just had a terrible weekend. And I told her maybe you need to go to a physical therapist to take a look at this and maybe see what the problem is and take that pressure off the lower back. Sciatica, I think, is there involved too.
Well, Michelle's great with showing people stretches to help ease pain and, routine morning stretches before you can get out of bed to help with that.
I know I've had sciatica problems here. I mean, I had to leave the show in the middle of the show one time. It was so, you just can't sit. I just couldn't sit, so I couldn't do anything. I couldn't lay down. I couldn't stand up. It was terrible. But so how long have you been with the facility?
I have been a physical therapist since 2000.
Really? 14 years. Going on 15.
And I've been with Keystone Rehab for about 2 years.
Yeah. You come in from Cleveland, right? Or in that area?
No, I come in from Trumble County.
Trumbull County, okay. Wow, okay. What can a person expect when they make an appointment then with you, for instance?
Well, first of all, Jeanette goes out of her way to get people scheduled and works with them, calls their insurance out of courtesy to make sure that we are covered and what their benefits are. It's a very family-friendly type environment. So when you come into our facility, you come in, we don't know you from Adam, but it doesn't take long before you are a part of our family. And when you don't show up for your appointments, we're calling to see where you're at because we're worried. We're very involved with, as much as people want us to be involved with, rejoicing with their celebrations and mourning with their losses. And so as far personally, which to me is a part of the healing process, where we do that, as well as making their treatment plans very individualized toward them. It's not a cookie cutter type facility. Every treatment is different. So your case of sciatica might be completely different from somebody else's. And so I would look at your symmetry of your hips and your that triangle bone called your sacrum and your legs. I would look at the whole picture.
Okay.
Maybe something's coming from your shoulders. So I look at a
I
person's
got
whole
that
picture.
too. From this guy, you know.
Yes.
Now you mentioned insurance covers this now?
Yes.
Most insurance covers. We do Medicare, Medicaid, United Healthcare. The only one that we do not take is Buckeye. And then we just refer them on to another facility that may.
Okay.
And at our other facilities, like in Girard, we do have aquatic therapy.
Over in Pennsylvania?
Correct.
Okay.
And that's Kate Johnson, and she's excellent. In our Geneva office, we have the FCEs, which a lot of workers' comp
Okay.
companies are wanting before their workers go back to work. But basically, at our facility, you know, we have the theory of you start as a patient, but you always finish as family.
Jim, I got to ask you this. You and I have talked on the phone a couple times. And what is the difference between your facility and others?
I think we have more of a personal touch. We don't treat people as a number. You know, if you call us and you say you're running 10 minutes late, we don't always make you reschedule. Depends on our patient load. We always try to do what's best for the patient in the long run.
Is there a charge, say, if somebody can't make an appointment?
Generally, no. If it becomes a chronic issue, then
It's
yes.
a different story.
Yes.
Now, are you right next to the Chinese?
We are right next to China Buffet,
Okay.
and you know, we have the lab core that is right down the sidewalk from us. We always get a lot of
Right,
people that
right.
come in and say, "Hey, we're here for labs." So we
Right,
just
right,
redirect.
right. Yep. Yeah, so it's pretty close by then.
Yes.
What about prescription? Do you need a prescription to come in and see Michelle?
In the state of Ohio, for my license, you do not need a prescription. However, insurances may dictate otherwise. For Medicare, for example, they require that you have a prescription to come see a physician or come see a physical therapist. So Jeanette always checks that for you. If you question that, and if you call a facility, we'll check.
Now, let me go over that one more time. So you do not.
Not initially to see Michelle,
Okay.
but generally after she does evaluate the patient, we send what's called a plan of care for
Okay.
the patient to the doctor's office, who, you know, they typically go to either their primary care or if another, like a podiatrist, for instance, has sent them, then we would send that on to the podiatrist, and if they agree with that plan of care, they'll sign it and send it back to us, and that becomes their prescription.
Correct.
Now, see, I had no idea that's how that worked.
So if you have a really close relationship and you see your doctor all the time, let's say a Medicare patient,
Okay.
and the doctor has told them before, I think you would benefit from some physical therapy, or even if they haven't, that patient might be able to call and say, I would like to go to physical therapy, and the doctor says, okay, that sounds fine. Then that's at the point they come in and do the initial evaluation, and like Jeanette said, then we send in my initial evaluation with this plan of care to be signed.
And that physician has to go along with
Right.
what you're saying.
Right.
Typically, there's not an issue.
I was going to say it probably isn't.
Right. The only issue that we have encountered are some of the physicians who have their own physical therapy, which they suggest to their patients, we'd like to see you here in our facility, but it is actually the patient's right to choose where they want to go, as long as their insurance covers it, as long as we're in network with them.
Right. Now, what's the difference between a chiropractor and a physical therapist?
There is a lot of parallels, and I personally really like to work with a chiropractor. They look a lot at where I'm looking at the musculoskeletal system, and they are too. They do adjustment, high velocity adjustments. I do not do that. I utilize muscle energy techniques and other techniques to align the skeletal system. And I do not do any high velocity, but we do parallel each other a lot.
What's high velocity?
High velocity is a manipulation, a snap, a crack, and not all of them do that either. So
I don't like that. I don't like that cracking thing.
yeah,
You know?
and they won't do it if you're not comfortable with it. They
Really?
have other they have other methods.
Now, what kind of training do you have to get into this business?
I have a 4 years bachelor's degree in exercise science
Really?
from Youngstown State University.
Okay.
And after that, I did an additional 2 years in Dayton, Ohio to get my master's in physical therapy.
Wow.
So about 6 years, and now they require 7 because they want most physical therapists to be DPTs, Doctor of Physical Therapy.
I'll be darned. Wow.
And Michelle is also becoming a health coach.
Correct.
She's adding to her repertoire.
So what's that going to entail?
I take a look at people's health histories in general, and I treat the whole person. For example, somebody who would be coming into the clinic, a lot of times I'll see people who have been diagnosed or not diagnosed with a chronic pain symptom, and I help them realize their limiting thought processes that are obstructing their healing process.
Mm-hmm.
And so I may recommend more than just physical activity. I may recommend certain supplements that would be beneficial. I would recommend certain lifestyle changes. It's a matter of looking at their lifestyle and what can we change for you to make your essentially your dreams come true. Your
Living
full wellness,
pain-free
living
and-
pain-free. That's right.
Do you follow your program as far as what you're trying to get other people to do? Do you keep,
She does.
You look like you're in shape.
I do follow my program. I usually am up. I do some sort of movement almost 5 days a week before I come into work. So I do that. I also do, I love yoga.
Do you? I like yoga too.
I do. I like eating good whole foods. I don't all the time. Shh, don't tell me.
Do you eat meat?
I do. I'm not a vegetarian, although I limit what I eat. Yes.
Yeah.
So,
Yeah.
but
She likes to know where it comes from.
yes.
Yeah.
But bring me chocolate chip cookies and I'll eat them.
I think all of us would. We've been talking to these gals here this morning about physical therapy. If you have any questions, give us a call. 593-7181 is our number here. Any other services that you offer, Michelle, other than what we've already discussed?
We do. We do at the Geneva office. We work together as a team, and in the Geneva office, they offer functional capacity evaluations, and that is from Colette. But we see all workers' compensation patient, women's health patients, just to reiterate, any surgical type patients, even kids. You have plantar fasciitis, we can treat that. I have a really good program for that, as a matter of fact.
Explain that, because I just, I always thought that was the plantar's wart thing. That is not the same thing.
No, it's an inflammation
Of the
essentially.
heel, isn't it?
Or that's could be, but more in the bottom of your foot.
Bottom of the foot.
In the bottom of your foot.
Okay. I hear that a lot.
It is. It's a big complaint, and so again, I take a whole body approach, and I look at the level of their hips and their knees and their feet, and make suggestions there. Then also try to get the inflammation down.
And proper footwear.
Okay. Oh, proper footwear. That's right. I also, they can call me. I do free health coach screenings, as well as screenings to see if they question if they're appropriate for physical therapy. I'd be happy to see them and to
Especially
do a
like
10-minute.
with elderly and if you're having trouble walking, balance, gait
Yes.
issues. You know, all they have to do is call the clinic at 440-593-2804. They can speak to me and we'll see if, what's appropriate for them. We'll get them in for an evaluation or a screening.
I'm glad you brought this up because you mentioned youth. So you take youth right up to senior citizens
That's correct.
for that.
Correct.
Let's take this call real quick, Michelle. Hi, you're on the air.
This is Sharpie again.
Yeah.
I have problems with my shoulders, like putting on a coat, taking off a coat, putting on a sweatshirt. Is there a therapy for shoulders?
There absolutely is. And I'd be happy to take a look at that so that you can regain more mobility in your shoulders.
Well, I'll have to look you ladies up because I have a problem. I have to lay on the floor to get my coat on and off.
Yeah, that's a problem
that is a-
sometimes.
Yes, that's
Yeah.
not good.
My shoulders are okay, but they don't go up.
Mm-hmm.
Yeah.
Yeah.
Okay, I'll have to look you ladies up.
Yeah, please do,
Please do.
Sharpie.
Thanks again.
Thank you. Bye-bye. Is there something he could do about that, or you could do about that?
Yes.
Is there?
Oh, she
Yes,
can increase
absolutely.
range of motion.
Yeah. Because that is, that, you know, I don't have it, but I know I've noticed people that can't really get their shoulder movement up, you know.
And that can be from a variety of different, from frozen shoulder to a rotator cuff problem to just an impingement. And, you know, I'm not one, I really have to justify my treatment with people. So if I'm not seeing improvement within a few weeks, I'm referring them out to somebody else. I'm referring them out to back to their primary care. I don't keep people forever before I determine that they're more appropriate to be
Gotcha,
followed
yeah.
up.
I've said this a million times on this show. About when I first started this show, almost 7 years ago. I don't know where. I think I slipped on the driveway in this kind of weather when it was icy, and my knee got stuck. I mean, it actually froze, and then the other one froze, and I couldn't get around. I ended up in a wheelchair. The doctor drained it. That didn't even seem to work, but eventually I had to get on medication to eliminate it. I think it was partly like pseudo gout or something, where you get that in your joints.
Yeah.
And do you ever have any problems with people with gout? Is there anything you can do about that, or is that a medical situation?
I would refer them to their physician. Now, would I take a look at what they're eating because I have the health coaching background? I absolutely would. But I always try to get their physician involved. I don't take it upon myself to practice outside of my scope of care, and I'll get their physician involved with that.
Of course, with gout, seafood is a shellfish or a no-no, you know. But now in my medication, I can have it, and it doesn't bother me, you know.
But of course, probably in moderation.
In moderation is correct. That is so much true, Jeanette. I would imagine this time of year, Michelle, you would probably come across people that are getting hurt because of the conditions out there.
Slipping.
Oh, absolutely.
Slipping.
Or they try and catch themselves, which actually injures them more than
More
if they
than-
would have fallen.
Another thing that I really try to stress to people too is the throw carpets, the throw rugs that you have in like your bathroom and stuff. Those are so easy to trip over.
Yes, they
Yes.
are.
It's dangerous.
Yes.
And actually, I have them, but I have them so they have the bottoms of them are kind of like
Non-slip.
secured. Yes, because it is so easy. I had some that did not have that, and I was tripping all over the place with
Definitely
it.
want to secure those corners if
Yeah,
there's
yeah.
corners.
Yeah, yeah. So, is there anything you'd like to introduce to our viewers to help them get through this holiday season, since we are in the holiday season?
I would. A big thing with what makes us different is the fact that I look at the whole body and the whole person, including their spirituality, their physical activity, their stress levels, their diet. I take a look at all of that if they wish me to look at it. So the one thing that I have to say for this, you know, now that we're going into the holiday season, it's a big stress time of year, as we all know, more so probably than the rest of the time of year. And there's lots of things that we can do to modulate stress. You know, stress, you know, when we have stress in our lives, that releases a hormone called cortisol. Cortisol, we do need that hormone, but in large amounts, it's not good for us. So we can do yoga for stress relief, we can do physical activity, we can do meditation, but one of my favorites, and it takes truly minutes out of your day, is doing a breath work, breathing. And I call it my 4-7-8 breathing. And actually, if you look on Dr. Andrew Will, this is a part of my health coaching training, but he has this on his website. So just for a reference, if you forget, this is who I got this from. And I do this a couple times a day. I teach this to a lot of my patients. So it's essentially, in simple terms, pushing the reset button on your whole entire system. Helps not just with lowering your stress level, but it could help modulate diabetes and hormone levels and lower your blood pressure. There's so many good benefits to proper breathing.
You mentioned meditation. That and yoga are kind of similar in a way. Kind of.
Kind of.
Because I do some yoga stuff for blood pressure
Yes.
reasons.
Good.
And I think it works.
Yes.
I really do. And it also, you know, when you're talking for 3 straight hours like I do here, you want to go home and just have some downtime where you're not talking at all, which my wife doesn't understand at night sometimes. But you know, meditation and also a little yoga intervention really helps relax
does.
you.
It
You know,
does.
and you're so right about stress in the holidays. It's out there. You know, my dad was a social. Well, he worked for the veterans, but he's seen a lot of stressful times with the vets out there, especially around any holidays. You know,
Right.
so
And it carries over in their physical therapy. If they're coming in for back pain and they are stressed out because of one thing or another, as humans walking on this earth, we have stress, but it carries over into their physical well-being. So if they can't get their stress levels under control, they're not sleeping well possibly, and even heightens their back pain
levels.
even more.
oh, okay, okay.
So.
What about you in stress? You're a mom with young kids, and does it ever get to you a little bit or no?
Not really. I have my husband's a great helper to me.
Yeah.
And my kids are great helpers, and so not too bad.
Yeah.
Yeah, I think the normal amounts. I think there's a spectrum of
I think
normal.
everybody has some
Absolutely,
stress.
Exactly.
absolutely.
You know.
You can't go without it
Right.
living on this earth. I don't think so. But
Right.
I try to keep it to a minimum, and I practice this 4-7-8 breath work almost every day.
Every day.
Yes.
Yeah.
So.
Yeah. What about you, Jeanette?
Oh, there's always stress. But Michelle and I, we just kind of work our way through it. And
Yeah. I really envy the person that doesn't get mad and just seems to be able to handle life as it comes at them. I'm not one of those people. I'm impatient, as my wife says. I'm very impatient, and I want things done like now, you know. But that's a problem I've had all my life. It is actually great that you girls came in here. I think it was very educational and informative.
Pat,
Thank
would you
you.
like for me to describe that? Take a minute to describe that breath work so the viewers at home
Yeah, please do.
could do that, because if they could do this, if you could do this even twice a day, it would be of great benefit.
Okay.
So the idea behind it, and it truly should take you 2 minutes to do this, is that you're going to exhale all the breath out. You're going to inhale for the count of 4. You're going to hold to the count of 7. And then you're going to exhale to the count of 8. When you exhale, your lips should be apart, your tongue should be on the roof of your mouth. This is a yoga thing. I'm not sure the theory behind it, except it connects your breath to your, I'm actually not quite sure. We'll ask our yoga friends about this next time, but your tongue is at the roof of your mouth, right behind your teeth. Your mouth is open and you're forcefully blowing out. So it's an inhale for 4, hold for 7, 6, 5, 4, 3, 2, 1, and exhale to the count of 8.
Wow.
It's actually quite relaxing and meditative.
Really?
It can be, yeah.
Yeah. Yeah.
So
Wow.
That's
I'm
what
glad you did that. That way you can have a little show and tell here. Fantastic. Thank you, Michelle, so much
You're
for
welcome.
coming in.
Thank you for
too,
having us.
Jeanette.
Thank you.
And come back to see us again sometime.
okay.